Good morning, everybody. I'm Jörg Huber, Director of the RDS Southeast, the Research Design Service Southeast, and we are presenting together with RDS London and quite a few colleagues this event on building capacity in social care research. I hope everybody can hear me, as I can't see or hear people, but I think that is the way the system works, which we are using, which is MS Teams Live. So it's a first for myself as well. So we should really have an interesting and exciting event. I will just say a few things. So the event runs till 12 o'clock with a very brief break in between at just shortly before 11 o'clock. And then we have at the end 3 breakout sessions from 12, or to be precise, 12:05 to 12:30. Details you should have and an agenda as well. So for now, I just want to add that the chat function is in this system disabled, but you are very welcome to ask questions in the question and answer section, which is an icon at least on my screen, sort of towards the top right, where there is a question mark in a speech bubble. So click that and you can ask questions, and we see through how many we get. We will perhaps be a bit selective or combine them as needed. But yes, do please use this. So welcome everybody. And to start quickly and on time, I would like to now welcome Dr. Mike Clark, Program Manager in the NIHR School for Social Care Research, who is probably familiar to some of you, but maybe not to others. And we very welcome Mike, and I hand over to you and your presentation.
Morning, Jörg. Morning, everyone. Nice to join you. I want to say good morning, and with that, I'll move on and share my screen. Right. So I've been asked to speak today about how is the NIHR building capacity in social care research, which does sound a little bit like what have the Romans ever done for us? But happily, as with the Romans, the answer is quite a lot, as we'll see. So NIHR has been supporting adult social care research for quite a long time now. The School for Social Care Research was first commissioned in 2009. And the NIHR has renewed that commitment every 5 years since. The NIHR building capacity. But in recent years, there's been a recognition that, there's been a recognition. Sorry, I was just getting a bit of echo back there. There's been a recognition that the NIHR needs to do more to support adult social care research, with more investment and more support to researchers, and particularly a recognition of the need to build capacity, and that's capacity to do research, but also to be able to use that research to help improve practice. And that's why we're here today. So broadly, in simple terms, the context is we have the public at the centre of the context, which means particularly people with care needs and their families, friends and carers. Around them, we have a very complex care system. Sadly, today we don't have time to discuss how complex that is. But then around that, we have researchers. And the NIHR has been building now for a few years a system to try to support increasing research activity in that area, and to support more researchers to provide evidence to help improve the care system and help improve outcomes for the members of the public. So the first element of that system is NIHR infrastructure. So there are a few acronyms in that box there: RDS, CRN, ARC. I won't go over them. If you know what they are, great. If you don't know what they are, then you'll find out about them today, because there are presentations on all of those things. But that's an infrastructure to help people plan and conduct research projects, which brings me to the second broad element of this system, and that's the research funding. So this is several research streams in NIHR that provide funding for projects to actually do research to help provide evidence to improve practice. Again, I won't have time to go over all of those, but it's just to recognise that there are a lot of funding streams there. And if you don't know what they are, at least by the end of today, you'll find out the names of people that you can contact to ask about them. And a bit later today, you'll hear about one initiative, a research practice network that's been funded by HS&DR across your regions. The third element, and the one I want to focus on now, is the support to individuals to help them build a career that's more engaged with research. And this is the capacity building support. So through the School for Social Care Research, for the last couple of years now, we've had additional funding from NIHR to provide a range of support to help with research capacity development. And our main initiatives are listed here, and I want to focus on a couple of them. The first one is the Career Development Awards, which are our main award, and therefore up to £50,000. And they're very, very flexible awards. They're really for individuals to apply and say, this is what I feel I need to take the next steps in my research career development. And that could be somebody who's already a researcher, maybe an early career researcher, or even somebody in the mid-career who's saying, I want to take a step up now to maybe develop my first grant application to be the lead for this research project, or I want to undertake some specific training, maybe on a method, so that I can be better placed to lead on some research projects. So partly they're aimed at researchers, but they're also aimed at people who are pre-research career, if you like. So that could be maybe people in practice who are very keen to start to engage more with research. And the sort of things that we funded there are some colleagues in local authorities, for instance, who want to do a master's degree. So they're interested, they work in practice and they're interested in learning more about research. So they apply to us for funding to do maybe a research master's degree with a plan that this will be not a one-off thing, but is part of a career development plan. And that's one of the key things for these awards, is that they're not one-off awards. We're hoping that people that apply will see this and make clear in their application that this is part of a long-term career development to engage in research. These are generally they're annual awards, and we anticipate the next award will be around the autumn this year, so look out for those. We then had Developing Research Leader Awards, and these have been, we're just processing our first round of these at the moment, so that's very exciting and interesting. This is more for people that are at a later stage in a research career and are looking to step up to be a leader of significant research programs or research units. And so perhaps that's not something that's quite so interesting for a lot of people on here today, so I won't dwell on that one. And then, but perhaps maybe if there are some people in practice, they'll be more interested in this one, which is the Practice-Based Research Leader Awards, which should be coming later this year. And this is for people who are based in practice and they want to take a lead across their locality or their organisation to develop more of a research culture in that organisation. And we're looking for people to say, this is some initiatives that I want to put in place in my organisation to help people, to help colleagues become more engaged with research and to use that research to help improve local practice. So as I say, look out for more information about that in the coming months. And perhaps maybe not quite so relevant, we have PhD studentships. So we're now building quite a cohort. I think we've had 3 years, this will be our 3rd year now of PhD studentship awards coming up. And these are funded within the 7 universities forming SSCR. And if you're interested in starting a PhD studentship, look out for those calls, probably into next year now. Internships for masters, so we have colleagues who are doing relevant master's degrees, and to try to encourage them to take more of an interest in social care research, we offer internships. So maybe if they're doing, say, an economics degree and they want to do a dissertation, to encourage them to start to think about social care research, we offer them a small internship bursary to help stimulate their interest and hopefully again lead to continue that interest. And we had a couple of people now that have had these internships who have gone on to do PhDs with SSCR. And then we organise an ongoing programme of workshops and webinars, which also includes a library of previous ones. So these may be about particular research projects in areas of interest to social care, or they could be methods ones. So look out for those and you'll find more information on the website. And then the Social Care Incubator is a virtual network, which hopefully the website will be launched later this year. And that will be to encourage people to start a network and see who they can connect with to help support them to do their research. I put a link in there to the capacity building section of the website, so hopefully the slides will be shared and you'll see more information about those things there. If you're there, have a look at the website. We've got a range of resources on there, methods, papers, reports, etc. So do have a look, and that's also a good place to look out for information about our funding opportunities. And also we do support the Journal of Long-Term Care, which is a peer-reviewed journal, free to submit and also free access. So if you're interested in some of the latest articles about long-term care research, which is an international term for social care, then please do look there. And we also support the Social Care ELF, which is people writing in a very accessible way about research papers. And so it's an opportunity to just keep up to date with some of the interesting research that comes out about social care and to look at it and read it in a more engaging way than perhaps some of the long journal articles and reports are written. I mentioned also the NIHR Academy. And of course, they've been doing a lot for many years now to support research capacity development in healthcare. Fortunately, the last few years, they've started to turn that support to help colleagues in social care, and their NIHR fellowships, which operate across the research career from pre-doctoral to doctoral and post-doctoral. And they are fantastic awards. They will cover all your salaries and training costs and so on for the level that you're at. But they are very competitive, and so I would suggest if you're interested in those awards, please do seek some good advice and support to help you put in an application. And fortunately, during the course of today, you'll learn more about where you can find that kind of support. And then the Academy is also launching more local authority aimed academic support. So these are fellowships. They have pre-doctoral and doctoral. They've had the first round of both of those, so you'll have to wait a little while for the next cycle of those to come round. And again, those are fantastic awards that will support your salary and training costs at the level that you're at, whether pre-doctoral or doctoral. And then they're also launching in a few months' time the Short Placement Awards, which is a small award that colleagues can apply for to pay for some expenses to go and spend a bit of time in part of the NIHR infrastructure to learn more about research and how the infrastructure can support you. So again, there's a link there in the slide so that if you're interested in those, you can apply. But again, they are competitive awards, so please do seek some advice and support. So hopefully you can see there are a lot of opportunities out there for colleagues to get support to develop research career, right from pre-research career all the way through the different stages of developing a research career. And there's a lot of infrastructure there to help navigate you through that quite complex system. So please do enjoy the rest of the day and do contact colleagues afterwards, including myself if you want to find out a bit more about some of these opportunities. Thank you. Enjoy the day.
Many thanks, Mike. We have actually, so we are very well in time, and we actually have time for any sort of questions if anybody wants to put them in the question and answer session, whether there is anything. In the meanwhile, I'd just like to really emphasize that opportunities for social care research have increased, I think, tremendously. And I think people like Mike and Martin Knapp, others at the School of Social Care Research, contributed significantly to making this happen. But also, I think the the RDSs and with all their activities promoted all these opportunities much more than, say, some certainly than 5 years ago when we really started, when we had actually a first major event. And actually Mike was talking then, that was and face-to-face in London, I think at King's College, if I remember rightly. Yeah, so are there any questions? Please type in. Otherwise, I'll just hang on a second. I would see whether Matthew Bushell is available now to take over. As we haven't had any questions, maybe there will be more questions later on. So I'll just hand over to Matthew, but many thanks, Mike, for this really very valuable overview, which sets the landscape of NIHR funding for social care research. Thank you. So can I welcome then Matthew Bushell, who is a member of Kent County Council in the Adult Services team as a manager. I have to admit, I don't know you more than having seen you now, but very welcome. And if it's okay, I'll just hand over to you.
Yeah, thank you. Thank you for the invite. Yeah, my name's Matthew Bushell. I'm team manager, as was said earlier, from Kent County Council. I'm actually in children's services at the moment, but I do support adults 18 plus in the leaving care service. So I've moved over from adult services and from the autism team. So I've got quite a lot of different experiences really. I think I've worked in every social services team, so I've got quite a good idea where the gaps are really, and you know, and what some of the questions we need to answer. And I'm here to talk about my research journey. I suppose it's good to talk about a local authority's own journey. And Kent County Council, we used to have a research team about 15 years ago, I think, and only a small element. And but it was disbanded, and it's nice now that we've actually seen some signs of things coming back. So we've become more involved in the local Kent, Sussex, and Surrey ARC, Autism Research Collaborative, is that right? And within that, we can, you know, we're linked into the different pieces of work going on and support available. And I think we actually got a researcher in. It's going to have an internal researcher again, and one in the local authority and one in the University of Kent. So we're going to be able to liaise on research agendas. So I think one of the main things for a local authority is we're such a huge monster. It's just hard for us to define what the questions we need to answer are, because we work with so many different client groups and so many different types of support. And though we do social care, we also lean into health, and in that juxtaposition between health and social care is it's a blurred area really. But it's nice for research authorities starting to consider now the impacts and the support needed in social care, rather than just a health agenda. So my personal journey is that I've always been trying to dip into research for years. It's just been a passion of mine as a social worker, to try and improve the service we provide to the young people and the clients that we support. And I first dipped into research probably in 2014. I was working in the autism team, and we was supporting clients with a higher, well, I say higher ability, but I know everybody's got different levels of ability, like we all have on a neurodevelopmental presentation. So my team was particularly set up to support clients without learning disability. And we were kind of finding our way really, and we didn't really know what was going to help people. But we had an occupational therapist who was also a mother of a young person with autism, and also had a social worker, senior social worker as well, who was a mother of a young person with autism. And together we talked about some difficulties, and we kind of realised what the question could be we needed to answer. And so that question was around, how can people best maximise their strengths living with autism in this difficult world we live in? And so we managed to speak to the University of Kent and get some advice off them. But essentially, there wasn't a great deal of support at that time. So we did it ourselves. We took some research and called it autism enablement. And we devised a way of working with autistic adults that was just mind-blowingly good. And it became research, and we published it, and it was brilliant. So that was the beginning of my research journey, really. And in this in the area of autism, we started to get together with some other agencies, so Public Health and Julie Beadle Brown Autism Centre. We worked very hard to try and find if we can get sort of platforms for future research. So we tried to get some research grant to develop a research database that was able to look at social and healthcare outcomes for the client group we were supporting. We still haven't actually done it, haven't been successful in the grants to this stage, but it was useful to be part of that process to see how collaborative working can come together to to define what needs to be done, because we felt we needed a platform. But then I ended up going to an autism conference, and that's where I bumped into Martin Knapp, who was mentioned earlier, and I called Martin over a cup of tea and just happened to be in the same area, and I said, I really want to get into research, I'm a social care practitioner, what can I do? And he put me onto the Building Capacity program, and I was supported to make an application, and my local authority supported me to make an application, and it was brilliant. And I got the agreement, and my boss at the time, who's now corporate director of adults, just by pure chance, sponsored me, and he said, yeah, you could do this research course. So I've been in the University of Kent all of this year and doing a research course. It's only a certificate in postgraduate research methodologies. I say only, it was quite difficult. And because I've already got an MA in social work. And so hopefully that's the beginning of my research journey. And so I'm classified as an early research fellow, I think. So I'm just completing that course. And it was mostly module based, eight subjects: qualitative and quantitative research, critical research, and what else now? Ethics, I think. And yeah, I've done all right. I've done about 65%, I think. So I've done well past, which is I'm proud of, because this was completed during COVID, during the most complex time we've ever had in social care. So I was able to do that, and my saving grace is probably I was able to do that online as well, which a lot of students it's really sad they couldn't go to the university in person, but for me it actually worked because I could jump on lessons and then carry on working. So I was effectively given a day a week released on the Building Capacity, and the course paid for. So it's a brilliant opportunity, really. I just didn't imagine such opportunities could exist. And I was supported by the research design service. Stacey was fantastic, and she still keeps in touch with me now, and asking me what I might intend to do next. And definitely want to pursue this area further. I previously was in autism services, and I've still got a passion for autism research. But I've also, in the last 6 months, worked in leaving care. So I've got a great understanding of those young people's and their journeys and their difficulties. And within that, I kind of see that in Kent, we've got the largest leaving care service, essentially. And 50% of our clients are what we call citizen young people. So people who are, born in the UK and have grown up in the English system. And 50% of people who have come to the UK, as unaccompanied asylum-seeking children, now adults, they're interested in the difference in the outcomes, and the difference in the citizen UK group is much worse. And that's a bit worrying, really, because both groups have been through same level of, different levels of trauma. There's, significant trauma through their childhood, and it feels like citizen group have got much less resilient to challenges, and I think it's maybe an area of research. But one of the difficulties I have as not someone who actually works in research and but works in social care operations, and I have a team to manage, is being able to do that navigation of what currently has been done, what currently exists. So we've had a meeting recently, and just a brief conversation with Public Health. But the appetite for social care research seems to be so great. But from one conversation, suddenly we had a meeting with a couple of people from university, some from my boss, and we're starting to get together some ideas now about how we can work in the future. So it's definitely a shift. I think some of these early investments in funding for social care research and really being proactive in getting people involved, I think is really showing dividends. And KCC adults have really stepped up, and they've got a program now about to start. I think it's $1.5 million funding. Looking at research for the first time, so it's really exciting. But the only problem is I've ended up in children's now by default. But what I'm saying is adults and children shouldn't really have a distinction, really. We're all part of KCC. So I'm pushing for children to be on board that one. And I think that's it for me, really. I suppose my learning through this process is that I'm not sticking to my PowerPoint if you can see that. I can't see if you can or not. My learning through this process is that it's very difficult when you're in an operational manager of an operational team to give this area enough attention, which is why some of these schemes are really good. I've only dipped my toes in the water briefly. But it is possible to do social care research without being fully supported by loads of agencies. We did ourselves as free practitioners in 2016. And what we did was the first enabling service that's ever been provided by a local authority for autistic adults in the world. And that just come from personal efforts. And I'm really proud of that. So it just shows anyone can do anything to put a mind to it. And the other thing I've learned is that we need to engage service users as early as possible with ideas and design level, really, because I think that's where sometimes we have ideas as professionals, but we need to be consulting people that we provide services to, because it's their experience, it's their lives, and they've got good ideas about where the parts of the system are not working, or the interventions or the supports. We need to break down barriers between academic and operational, and the health and social care. It needs to be just, it's all good research. You can't always separate health and social care, and we changed the mindset of social care practitioners. So research is seen as an investment because they're busy and I'm busy. We're all busy. We all make excuses that we can't really do this, but actually we need to find time to do this, because we need to find time to have better services for people. And the money's there, it just needs to be used better. And I just think, just only a small missive really, sometimes when we put bids in as social care, we get replies back from academic people who are screening the grants, and sometimes the language you use is different. And I think it just needs a little bit of compensation really, but we're not coming from a purely academic stance, we're coming from a more pragmatic practice stance, and just need to cast a tiny bit of slack on that, if that's not rude. It's just, we may be speaking different languages, that's what I was trying to say. And I think that's it for me really. It's just really proud and thankful for the opportunity to be, somebody who's been invested in my early career. And I am confused about the way forward, but I'd be talking to Stacey again, saying in the research design service about how I can move on and maybe get more integral in the wider KCC agenda as well, and linking into the ARC. It's just time sometimes. All right, so that's everything I was going to say, if that's okay.
Yes, thank you very much, Matthew. Interesting to listen to this, or I always find it very interesting to see how people move from what I hope I listened, as I'm also a bit distracted by all the backstage activities, that you moved into research probably from a state where you weren't such an active researcher before. No, is that correct?
No.
Yeah. And what interests me about that is also not only that somebody like you then was bitten by the research bug, as I call it, but also this issue of whether teams and organizations, and I actually see that as two sort of different elements, provide support or are willing to go along. Because what we find in the research design service, that if there is a lone researcher in an organization, up to now typically in a trust, NHS trust, then frequently people will find it extraordinarily difficult. Would you want to comment on this sort of, what role your team played or not, as it may be, and the organization? You made one positive comment about one of your senior colleagues who were supportive at one point.
Yeah,
at least.
yeah, that was my saving grace. Is that well, there's two things really. I had a really good boss in sensory and autism services who'd done research herself years ago, and she supported us. She said, "You ought to go for this. You've got a brilliant idea here around the autism and enablement research." But we essentially did it all ourselves, and we were lucky because we had a practitioner who'd had a research background as well, earlier life, and so we managed to do that. But this was like 6 years ago. Yeah, 6 years ago. And I think things have moved on a lot since then because of the investments we made. And even the last couple of weeks, so this new adult services program in KCC has come about, looking at having a proper research program, because we're part of the ARC, and we also got a Kent, and we've also got a design and learning centre as well, which supports some European research under Interreg. So I think we've got 5 or 6 programs on there. And I'm involved briefly in one called Ensure as well. So we do have a number of really, really passionate people. But like you say, we've always been a little bit like lone wolves. We have been, just sort of muddling along, trying to do our own thing. Like the stuff with the Tizard Centre and public health, that was just 3 individuals really trying to push things forward. And we still haven't succeeded, but we're going to keep trying. But yeah, I think it's becoming more formalised and systematic now, whereas it used to be just sort of personal efforts. And this is what this is I think where we're moving to. We're evolving into the right place now, where hopefully passionate people can be supported by a greater system. Because the other thing about research is what we did in the autism one is when you do it on your own as well, you don't get the buy-in either for the implementation side of it. And even now we're still struggling with trying to give that as a core offer, even though it's so amazing. KCC's never fully funded it. And I think that's a learning point, because you need to have your question designed and agreed by the local authority. But if you do this work, they will, and it's successful, they will implement these things. Otherwise, it's just something good to write about. And so, so you need the whole systems to be working for you, definitely. It's been a lonely place for the last few years, and it's not anymore. It feels like it's time to come together.
Yeah, I think that's a very important message, because that's what we find elsewhere, that organizations then, once they start engaging with research at multiple levels, things become a bit easier, and also experiences accumulates, which makes it easier to apply for monies and, of course, also be successful in the end. I was just going to ask you, as there was a comment in the question and answer, it's a comment really about the shift in language, or the differences in terminology language between the practitioners and the academics. And that's, of course, a problem which never seems to go away, and it's probably there for good reasons. But is there anything specific you want to comment or could comment on? I often, being an academic myself all my life, I think it's a two-way process where, we need to learn from the practitioners, but also probably the practitioners need to learn some bits from us. Otherwise, maybe this is just a lame justification of my existence. But that's how. Any comments on this?
I think it's working collaborative is the answer. Again, you said earlier about trying to work isolated. It's like we might have some good ideas about practice, and we know some of the questions need to be answered, and we've consulted with people, but to write it up in the format and to give a grant through in the standard required has to be more of a collaborative process, which is either people like me trying to get an education in how research works properly, or liaising with colleagues, in the Research and Design Centre or the ARC, or all the other different supports available now. I think the answer is collaboration. We can't just do things singly and expect, to be successful. And it takes a lot of patience as well. I didn't quite realise. It's silly maybe, but I didn't think it would be so hard to get research funds agreed. And if you have the right question, but it is, isn't it? Because so many people are competing for their money with other good ideas. So. Initially when I started, I was successful in everything I applied for, and now I'm not so much. But it's you got to keep trying, and you got to keep doing it and making it as professional and as competent as you can, and doing your background work collaboratively. So that's the answer, I think.
Somebody asked a question on, is it really feasible for you to do your job and research or carry out research, study? So you said you were out 1 day a week to do studying, but how was your work covered? How can you comment on this? Did you have, was your job backfilled or some other solution, or did you just work more hours?
No, it was backfilled in a way, but it wasn't necessarily as helpful as it could have been. And the reason why was because of COVID. COVID changed all of our lives, as everybody's, and suddenly we was into unknown territory, and it was all hands to the pump. So as much as I, tried to get that dedicated 1 day a week, I was doing stuff in the evenings as well, because I just couldn't always take that time, even though I had a limited amount of cover. So, and I think it's just an exceptional situation of a situation we're in a moment with COVID. I don't think, normally I think I would have been okay, and with best laid plans and everything, But no, it's difficult, and you'll give up some of your own time as well. I couldn't have all done it in work time, no way. But I think being an experienced manager as well, an experienced practitioner, I've been doing the job 25 years. I think I can, get my job done, because I know my ways around getting that done easily and quickly and qualitatively. And if I was early in my career, I probably wouldn't have been able to do it. And just been in place and everything.
Yeah, experience helps. Then there's another question about where somebody says, you mentioned that it's important that researchers have closer links with social care leaders and staff, and somebody from the ARC North Thames who mentions that how busy social care staff and local authority staff are. Do you have any tips for how to deal with this, improve on the contacts with the social care staff, or how to work with them, how to collaborate with them? And I actually would like to add, it's sort of probably two levels. There's the collaboration with the very end users of the social care services, and also, of course, with those who deliver it. I mean, I think it's something you touched on before, but yeah, over to you.
I think about the end users, I think you probably got to have quite robust service user groups already in place, really, to support research. And we had that in autism, definitely with Advocacy for All. We've got about 400 people with them. There's about 5,000 families under Ken Autistic Trust. So we've got a good reach into a service user group with them as well. So, we've done a couple of bits of research with them recently. There's been a little bit of health-funded research around peer support. And then we've got some European research around peer support going on at the moment with them. And in the leading care as well, they've got forums as well. So if you haven't got those, it's really difficult. And but I think the issue with practitioners is really, really pertinent, because it's never been busier. And I think the only answer is to create passion, create systems that are going to help people, but also buy people out of time sometimes, because it is hard. As I was brought out for that 1 day, even though it didn't work out 100%, that's the only way really you're going to extricate people who are really passionate to do research in social care. And but you also got to give a passion. You got to somehow. I sent a thing out to my team recently, 110 people, and I said about research, and I tried to put it in a really positive way, but I was thinking they're probably looking at that thinking research is some distant thing that they can't be involved in. It's this thing that academics do. And I was trying to say anyone could do research, and it's, we all got good ideas, and we all sit in meetings and moan about the services we provide not good enough. Well, let's do something about it. And a few people have come to me and said, yeah, I really want to be involved. So somehow we've got to sell the dream, really. The research isn't just some labour and it's some distraction we're trying to do. It's actually, it is what we do. It's making sure the best value, the best services can be, provided to our clients, so that we're not running ourselves ragged with no particular outcome. So yeah, I think it's all of those things really that answers the question.
Yeah, perhaps one last question which came through. it's sometimes difficult, and everybody, whether student and even us, fairly experienced researchers, find it sometimes difficult to get a really full understanding of what research has been carried out in an area, or what is already known in an area. So the question here is, how have you navigated that? And I think sort of I was wondering, when reading this question, did you have any support with writing reviews, whether this is sort of more rapid scoping reviews or more systematic, or was that in existence somewhere?
In my first research in 2015 in Neighbourman one, it was we did the legwork ourselves over a couple of months. We went through everything we could find, so we did it ourselves. And there isn't a great deal of research on autistic adults, sadly, who haven't got a learning disability. So, it was easier. But I've recently had this conversation with my new team. This is why this new meeting has been set up with the ARC and university and the public health. I asked a question of the library, public health library, if we could have some data on outcomes and research for leaving care young people. And the answer, and I'm not criticising anyone, it's the truth. The answer was adult services don't fund the library anymore, so we can't. And I said, well, I think we need to be thinking about the corporate parenting and the fact that we're all one system. And then they agreed in the end to help us. So we do have people that can do it. It's just whether or not it's funded by different parts of the system. This is where it gets complicated, because you've got children, adults, social care and health, and really it should be, someone's got a brilliant idea. Is this a real idea? Is this stuff that's already been done? Are we reinventing the wheel? And somehow we need maybe through the ARC, a better system where we can, do literature reviews and systematic reviews, because, you can't expect a practitioner like me to be able to know my way around that system. We managed to do it once because there wasn't a lot of detail, there wasn't a lot of stuff written, but it is difficult to know. And so somehow we need a better system for that, so we know what currently exists.
Yeah, thanks. I think I will need to close this conversation now. Many thanks, Matthew. Really good to have you here and, talk from practice with the challenges you experience and some of the solutions you obviously found for some of the problems, probably not all, as you just alluded to this issue of accessing evidence or identifying evidence and synthesizing it. But yeah, many thanks.
Thank you.
Okay. So we'll move on to the next talk, which is really Martin will give this talk on behalf of the RDSs. There's RDS Southeast and RDS London, or the other way around, whatever you want. It's a really shared project here, this event. So I will just now hand over to Martin, who is he's the social care lead for London and who presents our overview on what the RDS can do for you. So over to Martin.
Great, thanks, Jörg. Hi everyone. Yeah, I'll start. We've just got some slides to go through. So as Jörg was saying, we're going to be kind of giving an overview of where the RDS can sort of fits in with the support that's offered. Let me just share my screen. There, I hope everyone can see that. So yes, well, Jörg's already introduced me. We developed this presentation very much together with our colleagues in the team. And for some reason, there we go, it's working now. Okay, so the Research Design Service it's one part of the National Institute for Health Research sort of menu of supports for research, for health research, but increasingly for social care research, as we've been kind of talking about today. This is it's a free for people using it, confidential advisory service, and we deliver it regionally across England. I mean, we've been working with London, between London and the South East, but there's links to all the different regions of England. We'll send that out with the presentation, and we support all the different professionals. I think Mike mentioned that in the questions and answers. So social workers, medical clinicians, and other health and social care professionals, as well as academics at all levels. And this the overall aim is to improve the quality of applications for social care research for all of the different funding streams within the NIHR, health, global health, public health and social care, but also other funding streams that are related to health and social care. As long as they're kind of national and open and competitive, then we can support researchers to develop good applications. And we help a wide range of people, again, thinking about the target audience for today, certainly people who are new to research, and we can have very kind of early stage discussions about ideas and how to start developing them, from practitioners particularly who, as we've just heard from Matthew, but eager to progress ideas. And we can, anybody needing advice on study design. Some of the things that Mike was talking about in terms of the capacity building elements and the NIHR, I mentioned the NIHR fellowships. We support anybody applying for those. Anybody who's got to a point of submitting, and then from an early stage, a first stage of an application, a lot of funding streams, you have to go through 2 processes, so we can support you thinking about what you need to do, and as well as very experienced applicants. And we get a lot of researchers who come back, quite senior researchers, who it's always good to have that extra eye on and what you're doing. And we do kind of, again, we like to think it's kind of a holistic approach. It's more than just design. Obviously it is that, guidance on study design and research methods. But we can help in thinking of suitable funding streams, as I said, both within and beyond the NIHR. Public involvement, service user involvement is a very key theme for the NIHR in all funding, and the RDS can support that, particularly in that difficult process, the kind of unfunded process of developing your research proposal. And we can help get the narrative right. So, all of these elements, the question and the methods, and making sure, as Matthew was just saying, about the question kind of leads on from existing research, and then really showing how the methods will answer the questions, and very importantly, what will the research do, how will the research change the world, as it were, change social care practice and improve outcomes. And that has to, in an application, become a kind of coherent whole, a kind of narrative. And that's very much a lot of what we do, I think, is trying to sort of make that a coherent application. A lot of the fellowships, and I'm sure the SSCR kind of capacity building programs require interviews, and we support applicants to prepare for interviews and to mock interviews, and kind of, as I was saying, interpreting feedback from initial applications. Social care research, the RDS, has been, as part of NIHR, has taken on, sort of increasingly taken on social care research, and there was a lot of work done to kind of think of the different elements of support, particularly for RDS. Sort of within RDS, how do we kind of increase the levels of skill within RDS to support social care research, as well as sort of linking with all the different parts of the NIHR, quite a few of which we're talking about today. And the model targets and has main sort of work streams supporting social care researchers and anyone interested in social care research, but also kind of a broader remit for encouraging social care research in the RDS regions, and linking, again, that's very much where we might link with the other elements of research support, and contributing to funding streams and thinking about what needs funding and so on. So there's quite a broad range of general activity. There's a lot of expertise that we can link with. I mean, a lot of the advisors have a lot of expertise, but there's also particular experts we can draw upon across all of those areas, obviously including social care and involvement, but the different elements of research, and we're kind of broadening our area of expertise. Particularly data science has been a recent addition to the support that we offer in London, and public health, kind of broadening the scope. So that once you kind of seek support from RDS, that can be a gateway to kind of a wide range of expertise. So when you do that, and that's through the website, and then the links are at the end. I'm going to quickly show the links at the end of the presentation, but also you can, all the links to the various regions will have a button saying, request support. And you get a dedicated advisor who is a case manager, but also kind of offers initial feedback on the question, the rationale, design, that whole kind of element of narrative I mentioned earlier. Then you can then offer that very clear, more kind of specialist expert on all the elements of research methods and sample size, mixed methods, mock interviews and funding panel that we talked about. So there's that specialist input. We can all, and our applications have to have a lay summary. We can help getting reviews of those because they're scrutinised quite closely for the language and making sure they're very clearly understandable by a public audience. And I'll talk a little bit more about that in a minute. We've got some public involvement bursaries that are helpful for putting bids together. And we link with, as I've mentioned, we're linked with all those other elements, the applied research collaboratives, clinical research networks, and also clinical trials units and trust R&D, that kind of, as I think Matthew said about the blurred boundary between health and social care. So there's a similar boundary within research. So as I said, the public involvement fund, this is for London and South East, and obviously this is the London and South East area, so I'm not actually sure whether this is offered nationally, but all applicants for people who request support can request a kind of basic small amount of money, but could be very useful just to get some involvement in that early stage where you've got maybe no other funding to do anything, so maybe just to get some discussions going. And if you're thinking if there is some more novel or creative public involvement in London, we've got a more competitive, the kind of basic level is you kind of make an application, but there's a competitive element to the higher funding ceiling. And that is applicable to the research for social care and research for patient benefit, kind of P's and B's, right? So that's a good level of support for public involvement, again, which is such a key thing. And I've been on funding panels, and the scrutiny of what you're going to do and is it meaningful is quite intense. So getting in touch, very as early as possible. Those early discussions about refining questions, I think, are really useful. And those are our contact details in the South East and in London. These are the social care advisors, again, in London and the South East. Just so you kind of can put names and almost all the faces. These are the links to the local research RDSs, so a quick skip over these. Just a couple of mentions. There's a new Research for Social Care call for call for research funding. It's going to be launching this week. We thought it was going to be last week, then we think now it's going to be this week. And the closing date will be in October, so you should have about 3 months to do the application. It's themed about dementia and mental health, but the mental health one is focused in the north of England. We're running an event on both of those calls in July and August. And then there's the open call for research for social care. This is the dementia and mental health one are extra, and then there's the standard. And again, we'll research for social care, which is researcher-led, so any topics, and we will probably be involved in running events about that as well. And that's me. Thank you. I shall try.
Thank you, Martin.
Oh, the screen's disappeared. That's good.
Thank you very much, Martin. Very helpful to have this overview. I hope it's helpful not only for us to have a clear picture of where we become active. I would say, in the service of time, if people have additional questions, they can either be brought up in the breakout sessions later on, or do ask any questions in the question and answer sessions, and Martin or any of the others on the call will be happy to answer. So I think we need to have a 5-minute break for everybody. So can I suggest that we restart 5 minutes past 11, but we will try and start punctually then. 5 minutes past 11 it is to reconvene. Thank you very much, everybody, for attending, and see you in a few minutes. Hello, everybody. Again, I hope people can hear me. We are now moving on to the second part of our event, and I would very much welcome Professor Annette Bowers. Is that the correct pronunciation, or is it slightly different? Sorry if I get it wrong.
It's the one I use.
That sounds promising. Thank you. So she will talk. She will talk now as the next speaker. She's the lead in London Social Care Partnership and Professor of Health and Social Care Policy at the London School of Hygiene and Tropical Medicine. Straight over to you, Annette.
Actually, Anna-Marie and I have kind of woven our presentation together. I think Anna-Marie's going to start. So.
Oh, sorry, Anne-Marie.
That's okay.
Anne-Marie, just to say that Anne-Marie works at Kent in the Centre for Health Services Studies, and I think she's a reader now. Yes, there it says. Anyway, over to you. Thank you very much for joining us.
You can see the screen then, that's good. Okay, yep, yes. Thanks, Jörg. So yeah, Annette and I are going to talk to you today about the new NIHR Social Care Partnerships. Okay, so a little bit of history before I go into any detail. So the partnerships were developed in response to an NIHR call for proposals to develop a research capacity building partnership in adult social care across England. And this was really partly in recognition of the fact that we needed to invest in adult social care research to develop sort of research from the grassroots, really. And we've already heard a lot today about the other ways in which NIHR are investing in the adult social care research infrastructure. So we've heard about the NIHR School for Social Care. In a moment, you're going to hear a little bit more about the applied research collaborations. We've got Professor Julian Forder talking a little bit about that. We've already heard about the RDS, but also wider than that, there's been real investment in terms of increased funding for social care related research projects from NIHR across different funding streams, and also things like the Enrich Network, which is enabling research in care homes, which is supported by NIHR. Altogether, 6 successful partnerships were funded. I'm not going to take you through that whole list, but just so that you've got an overview of the lead institutions and principal investigators for each of those partnerships. And what we're going to talk to you about today is the one led by Annette at London School of Hygiene, Tropical Medicine, and the one led by myself and Gina Walton at Kent County Council for the South East. So a little bit of background, what these partnerships will do. Well, collectively, they aim to build long-term collaborations between different social care partners. So this is between academic institutions, local authorities, social care providers and organisations, but also members of the public, people using services and their carers. Most of the partnerships use a co-production approach. So this involves collaborative prioritisation of research strategies and ideas, but also thinking about how together we can provide both the context and the mechanism for capacity building in adult social care research. Models that are being used, we will talk specifically about OWL2 in a minute, but research and practice models, things like developing communities of practice in adult social care research, but also having researchers embedded within social care organisations and local authorities. And really the aim is to create a research culture across our regions, and each of the individual partnerships have built-in evaluations. So we will be looking about what works for whom and in what context, and hopefully there'll be lots of opportunity for cross-partnership working, but more importantly perhaps cross-partnership learning. So to tell you a little bit more about the Kent Research Partnership, it's a 4-year programme of work, and you can see here that there are 4 different work streams. I'm going to talk about that work stream 3 at the bottom a little bit in a minute in a separate slide. But the work that started already in June of this year has been to start developing communities of practice in Kent. So communities of practice, for those who aren't familiar with that term, are basically groups of people who are brought together with a shared concern, maybe they want to address a set of problems or a particular interest in a topic, and they come together to fulfil both individual and group goals around that. And we hope to establish 3 communities of practice in Kent around adult social care research priorities. And we've got an event coming up that I will send you a link to in a minute. That was the first of these, where we will bring together the sector with academics and wider partners, members of the public, to try and establish what these communities of practice will be. So this is very much about not us as academics saying what we think the priorities are, but working with partners and with our communities to establish these from the grassroots. In the second work stream that you can see beneath on that orange block, we've got a plan to recruit 2 researchers in residence. This is a model that's been used in health research, but not really in social care research. And the idea is that both KCC and ourselves at the University of Kent, we will recruit a post each. At the University of Kent, it will be a experienced researcher, and in KCC it's most likely going to be somebody with a practitioner background, and that the 2 posts will work together to really ensure partnership working across the programme, and they will be co-located. So we would expect our researcher to be co-located in Kent County Council some of the time, and equally we would expect the KCC post to be able to have full access to university resources, materials, office space for shared working. And together these 2 posts will basically support all of the other streams of work that are happening as part of the partnership. I won't talk about work stream 3 now, I'll talk about that in a minute. So if I move straight onto the dissemination work stream. So I think really importantly, in the development of the proposals, we linked in with other social care partners that had got through to stage 2, and we built in some opportunities for joint working. So I think these links are going to be really important. We'll have links through kind of networking activities, showcasing events, and hopefully there'll be opportunities to come together and apply for funding in the future that will obviously give us greater national reach and significance than we have within our individual partnerships. We also very importantly think that we need to find ways to reach out to that wider social care workforce, and that's something that we heard Matt talk about earlier, was how do we ensure that practitioners know what's going on, what's being funded, what's coming out, what kind of evidence that we're finding as part of this kind of social care evidence base. So we're going to be holding research informed practice events for managers, practitioners, both within KCC and in the wider social care workforce. And we're also going to be developing online resources that people can access, and hopefully in an accessible format that will be an opportunity for people to tap in, reference and find out what's happening and what the latest research findings are. There'll be a showcase conference, but also the usual kind of things like academic publications and international conferences. So perhaps more importantly, what are the opportunities for practitioners as part of the Kent Research Partnership? I think first and foremost, what we would like is to encourage you to join vibrant communities of practice. So these are being established now, and there's a link there to an event that we're holding on the 23rd of July. I'm just checking that I'm getting the right date, 2 till 4:30. So I really encourage any of you that are listening today that work in Kent or even Surrey and Sussex and are interested in being involved in these communities of practice, please do sign up to this first event if you are able to. Once you're part of a community of practice, you will have access to training and events that will build your research knowledge and skills, and you will also have the opportunity to apply for one of our research and training fellowships. So these are really exciting opportunities. Thinking about the previous presentations, one of the big issues for practitioners getting into research is having the time and the funding to be able to buy yourself out of your day job. We will have 3 £90,000 fellowships as part of the a part of this call, and these will be funding to buy yourself out either part-time or maybe on a shorter term full-time to undertake research relating to priority areas that have been identified and supported by those communities of practice. So we would also support that through the research network as part of the partnership. So you won't be on your own. You'll very much get the support of the wider research team and the research design service, and also the applied research collaboration Kent, Surrey and Sussex. So you're not going to be on your own. If you apply for one of these fellowships, you'll get lots of support to make sure that it's successful for you. All your research and training costs will be included within that fellowship, including one conference fee. So you'll be able to present your findings, and that's really important experience for anyone that wants to start thinking about a research career, and also an open access publication. We'll also be able to access online resources and attend those research informed practice events. So lots of really exciting things coming up. The first thing being sign up to really inform these communities of practice. Okay, so that's enough about the Kent one. I'm going to hand over now to Annette. I'll move the slides on for you, Annette, if you tell me when to.
Thanks, Anne-Marie. So as Anne-Marie's already mentioned, the really exciting opportunity with this programme of money from NIHR is that there's 6 very different projects that are looking at kind of building this idea of research and practice working more closely together, but using different approaches and mechanisms. So hopefully by the end, we'll know so much more about what it means to work in partnership to create research that's more useful and usable and ultimately improve services in the sector. So our project, which is called Creating Care Partnerships, is based in the care sector and based specifically in residential care for adults. And the idea with our project is we want to work really closely with local sites to develop these partnerships together. So they're going to be quite small. They're going to be, say, a local university and a local care provider. And they're going to be thinking about what they want their partnership to look like together. But what we have at the start of that process is an existing approach called research practice partnerships that's been used in other countries. So it's been used in America, Australia and New Zealand, and it's been used in other contexts. So it's been used in mental health, it's been used in education, and it's been used in social work. So this approach has been tried and developed, and there's some really promising results, but it hasn't been used in adult social care, and it hasn't been used specifically in care homes where we're really going to focus in. So we've got quite a big part of this project is working with design colleagues to actually co-create a sort of blueprint. So what do we think these partnerships should look like? And I have to say it's already been really brilliant working with designers, because they bring a little bit more kind of energy, excitement and non-paper based working, because as academics we often just like to write lots and lots. So that's been really great. And then once we've created that blueprint with a wide range of stakeholders, we're going to then run an expression of interest and ask 3 partnerships we're going to ask for whether people would like to be partnerships, and then we're going to work again with them to build kind of tailored partnership models that meet more their local context and needs. And as Anne-Marie mentioned, all 6 projects have a kind of strong evaluation component. So the team at LSE are going to be really trying very hard to help us understand the complexities of building up these partnerships and whether they really make a difference for how we do research. Are we doing research differently in the future, and whether that makes a difference for the people who are using the services and for ultimately for their outcomes. So I guess what I wanted to move on and say on the next slide is a bit about what this means for you and whether you might be interested or could get involved in some way. So we're going to have these 3 partnerships. So there'll be an opportunity to lead or participate in a bid to form a partnership, and that process will start in September this year. So we are currently developing up the expression of interest document, which will be widely circulated, and that'll be an opportunity for people to come forward and say they'd like to be a partner, and those partnerships can actually be anywhere in England. So if you're interested in that, I'll give you some details about how to get in touch with us. As Anne-Marie said, there's a lot of learning network work around this programme across the 6 projects, but we also have a learning network for people who may not be one of the 3 partnerships, but are really interested in just learning as we go along through that process. So we have some resource to support anyone who wants to join that learning network to learn with us through the project, specifically about how these 3 partnerships develop. There's going to also be an opportunity in the final work package to help us think about whether we can think really carefully about how we spread this idea more widely. So whether we can spread it more widely in the care home sector specifically, or whether we can spread it for the benefit of kind of adult social care more generally. And also we've got kind of a component of that's about spread to the rest of the UK. And also we're going to have kind of resources that are coming up as we go along. So the designers are helping us develop a virtual bookcase of resources. So things we collect about this work we'll be putting on that open access bookshelf that people can draw down and have a look at. We're going to be developing this shared open access blueprint for a partnership. So that'll be our starting point, and a starting point people could also take away and have a go. And there'll be these opportunities to join network events and to learn from the work as we go on. And also to actually participate in some of that co-design work if you're particularly interested in how the partnerships can form. So at this stage, the things to do would be to get in touch with me, and I can share my contact details, or to start following us on Twitter. We've just set up our Twitter account, which is @care_RPPS. And there will be all the information about the things going on will be shared through that route. Or please get in touch with me directly, because we really, I think you probably picked up from Anne-Marie's partnership proposal as well. This is very exploratory work, and we're really interested in engaging and having feedback from people as we go along. So thank you very much.
Thank you very much. Thanks to Anne-Marie and to Annette. Very interesting, really. I find that really a great success, particularly maybe for our region, as we perhaps haven't, or in some parts of our region, that's KSS, we haven't had that much research in social care, although in the Kent area, of course, it's very strong. Can I just say, in the service of time, there is whether you may want to put the Twitter links into the question and answer if you want to, and also if there are any. There is a question for I think Anne-Marie and Annette regarding who can apply, and maybe they can respond to that in the question and answer session for the person for this request to be answered. So I'd like to quickly move on, but say thank you very much to both of you, and maybe that can be picked up also in one of the breakout rooms if possible, or yeah. So I want to welcome now Julian Forder, who is the social care theme lead for the RKSS and also the national priority lead in that area. So very welcome, Julian, and I hand over straight to you to sort of keep moving forward with given that time is tight. Thank you.
Thanks a lot. Thank you, Jörg, and great to have a chance to speak about our ARCs, and thank you for the invite. Let me just share my screen. Hopefully that looks good for you. So ARCs, again, another acronym, as Mike mentioned. NIHR does clearly like acronyms. This one stands for Applied Research Collaborations. And the idea is that these ARCs were set up on a regional basis. There are 15 covering regions across England. And their main aim is to improve health and social care, but particularly through implementation of applied research and getting applied research into practice. This is really focused on implementation or translational research. And a way to do that clearly is to ensure that there are very strong partnerships on a regional basis with the key providers and deliverers of social care and healthcare services, and the array of other organisations and bodies, voluntary sector and so on, that are involved with this. So we have an ARC in Kent, Surrey and Sussex. It's hosted by Sussex Partnership NHS Trust. And like the other ARCs, in the process of setting these up, ARCs were asked to put forward their main research themes. There are 8 for ARC KSS listed on the slide there. social care being an important one, but also linking well, I think, with the other areas, including children's mental health, dementia services, primary and community services, and these cross-cutting themes of co-production, public health, digital innovation, and health and social care economics. So what do we do in our KSS in our social care theme? What we've done is split this really into two parts. So our regionally focused work and then the national work. So on the regional program of work, we have three main activities. And going back to the aims of the ARCs, one of the key things for us is to be able to identify what local social care priorities are. So it's really important for us not just to have our own views as to what priorities are, but to work with the sector and understand where the gaps are, what evidence and needs are out there, and help to address some of those gaps. The second is through undertaking research infrastructure and capacity development. So we link quite closely with the other parts of the NIHR, particularly the School for Social Care Research that Mike talked about, with the aim of trying to develop resources that people can use to push forward their research in social care. So social care, I think, is coming perhaps from a lower baseline than our colleagues in healthcare, but particularly working through our ARC networking activities recently, really found, and I think Matthew was saying earlier on, a really strong desire to get into research, keenness to be involved, which is of course very encouraging. And the third activity set for our regional program is around research and implementation projects themselves. So doing those things very much in partnership with stakeholders in Kent, Surrey and Sussex. So then moving from the regional to the national work. When the ARCs were set up, NIHR then asked consortia of ARCs to work on what they regarded as high priority challenge areas, and social care was one of those, one of 8 in fact that were identified by NIHR. And so we put together a consortia of 9 ARCs to work in that area. And so to some extent it mirrors what the ARCs have done regionally, but the idea here is that we will take the work that's done in regions and see how this can apply across different regions, or supra-regionally, indeed, as it is described. So again, it's about trying to understand what the priorities are, but then doing research and implementation support. So for example, we might find a particular social care activity in one region has promise, and one of the things that this program would do would be to see whether or not that implementation could happen in different parts of the country across different ARC regions. So the question we were set was, how are ARCs supporting social care research? And I thought that there were perhaps 4 ways in which we were doing that, and I'll go through each on a slide in a second. But they are, first of all, to help establish research priorities. So where are the gaps? What is it that we should focus on? What's the important topics? Secondly, to offer some support in terms of capacity building around the research and the research infrastructure. Thirdly, engaging with the care sector in actually undertaking research. And fourthly, undertaking projects, indeed in partnership, and also supporting further research applications. So priorities for social care research. So we've been working on this particularly in both our regional KSS work and also nationally in the National Priorities Programme for social care. And for example, we've just undertaken some focus groups, both with professionals and practitioners, and we were very fortunate to be able to engage a wide range of social care stakeholders, from local authorities, providers, voluntary sector organisations, and indeed research active organisations in the field. So that was very encouraging. And similarly, a great session with members of the public advisors on what are regarded as social care priorities. So some examples are listed on the slide there. These are some of the areas that we've been developing in the National ARC programme. I won't go through all of them, but to pick out some of these, and I imagine that none of those are a particular surprise to people. But for example, outcomes need indicator tools. So we know in social care there's been an indeed entirely laudable rhetoric around making sure we are very focused on outcomes. Doing so in practice is much more challenging than, for example, a focus on services and the process aspects of care delivery. So working around developing outcomes and needs indicators is very helpful in that. Digital technologies, particularly during COVID, have been really important, particularly around communication, as well as through, for example, assistive technologies. It will come as a surprise to no one that integration with health and social care, mentioned a couple of times already today, is another area that we have seen as particularly important, and that could be through, for example, people transitioning in and out of hospital, intermediate care, but also in the way that, for example, health and social care work together. An example being use of shared care records. There's quality improvement, the peer challenge, so whereby councils offer challenge and critical support to other councils to help them improve the way they deliver services or support the delivery of services. Integration between adults and children's care. Welfare rights is another focus, important in allowing people to navigate their complexities. We all know about the complexities of the care system. So welfare rights advice services have an important role to play there. Indeed, innovations come from the social care sector, working with other parts of the welfare system to support people during COVID. And there's also has been a focus on how community resources and so-called strength-based approaches can help us in moving the care system away from perhaps a more deficits focused to a more strength-based or positive focus on how we plan and commission services, and care markets indeed as an important part of how care is delivered in this country. So the second, research infrastructure and capacity support. A couple of things that we've been doing in the ARC programme. We commissioned some work on public community involvement, engagement and participation, led by colleagues at ARC West Midlands. Done a great job so far. I've just this week published a report, Equal Access to the Knowledge Table. If you get a chance to look at that, I thoroughly recommend that piece of work. We've also conducted a number of seminars. Indeed, there's another one this week on evaluation in adult social care on Thursday for the ARC programme. Do look at our website if you want to attend that. And other ways, I think we've tried to develop the infrastructures around what we call proof of concept or use case studies. So a particular priority for us in Kent, Surrey and Sussex region was about the integration of health and social care data sets, particularly at the individual service user level. We know that there are significant challenges in bringing those data sets together and having them accessible for research purposes. Proof of concept or use cases, examples of how they can be used, help with getting those things into operation. We have an ARC studentship that's actually currently live, I think, until the 23rd of July. So again, if people are interested, please do look at that. And the National Priorities Programme, part of our activities there are around supporting the sector in research, and in particular working perhaps with sector leaders on a more national basis to develop the research infrastructure. So third area, engaging with the care sector, as I said, the sort of the core theme of the ARCS is working with local partners, and so we've undertaken a fairly extensive, I think, set of engagement activities with our local networks, and have had lots of good conversations about what people are doing, what they think is important, and so on, and involving the wide range of stakeholders in that. That can then come in to allowing us to help partners in projects, but also with things like supporting applications for funding, again something that Matthew was talking about earlier on. And we too are seeking to host communities of practice. This seems to be a very important way forward at the moment. Last area is actually indeed in terms of the projects that we are undertaking as an ARC, and we have some projects that are on the go at the moment, and others that will be developed as part of the National Priorities Programme. Again, trying to engage a wide range of stakeholders in that work, but offering again contributions to how the evidence base in social care is developing. We did some projects around COVID, particularly in domiciliary care. There's some work with adult social care outcomes tool in care homes. Integration is another programme. So that gives you a flavour, I hope, of some of the things that we are doing in ARC to try and push forward the social care research agenda. I've been involved in social care research for many years now, and I'm passionate about having this agenda pushed forward. I think there are some real opportunities, some great potential for social care research. There's some very exciting developments, and see a real acceleration and step change, which is incredibly welcomed and valuable. So I'll end there. You can see a bit more of our contact details there, and very happy to follow up with questions or queries. Thank you.
Thank you very much, Julian. Very useful to hear about all the plans there are and the activities now happening, which is really great. I haven't had any queries or questions and answers, but I think perhaps we just move on. I think, Julian, you will be here for one of the breakout rooms, if I'm right. So yep. That's great. So many thanks to you.
No problem.
Okay.
Talk to you later.
Yeah, thank you. I just want to welcome then Becky Dilly, the Research Delivery Manager from the Primary Care, Public Health and Health Services Research and Social Care for CRN. It's a long title, Becky, you have there on our sheet. So anyway, Becky will represent the contribution CRN, the Clinical Research Network in our region, makes to, and probably CRNs more generally across the country, makes towards social care research. So very welcome and thanks for joining us. Over to you, Becky.
Thank you. Thanks for having me. And I am actually joined by a colleague, Sandra O'Sullivan, who is going to help chip in. And there's a space on the agenda. I know. I wondered whether her name was actually there. But yes, this one person. Very sorry about this.
That's okay. Very welcome to Sandra.
So I think I'm going to do the speaking, and Sandra's going to chip in as and when, and if there's questions or anything, and I think maybe share some information on one of the examples we've got. So let me just get my screen share up. Oh, which now, after practicing earlier on, doesn't seem to be working.
It looks as if you selected your own video image by mistake. So if you perhaps, or if somebody else can advise, I think you may need to unshare and then share the right screen.
Yeah, when I open the share tray, it doesn't show me the share tray. It just says include system audio.
Can somebody help, Becky?
Sorry, everyone. I'll try and load it up for you now, Becky.
Thank you.
Just a second. Just bear with me.
So we'll wait a few seconds. I'm sure it will happen very quickly.
I can start talking anyway, even without them. You know, slides are good, but they don't.
I just need a couple of minutes. Won't be long.
Yeah, no problem. Thank you.
Lovely. Thanks, Becky.
Yeah. So I'm Becky Dilley. I'm a research delivery manager for the Clinical Research Network, covering Kent, Surrey and Sussex, and as it said in my job title, several different clinical and non-clinical specialties. And I think that's the first thing that I kind of always like to start when I'm speaking with people in a social care or other sort of out of NHS context, is that we're called the Clinical Research Network, but that's a bit of a legacy name, and we don't just support clinical research. It's health related research, and the research that we are supporting is expanding as time goes on really quite quickly. So we're definitely moving out of NHS and clinical research and thinking more sort of health related. So I'm just going to run through, with Sandra's help, what the Clinical Research Network does. And as you've learned from everyone else this morning, there's lots of abbreviations and an acronym. So we abbreviate ourselves to the CRN. I'm going to talk about how we operate and what we do currently to maximise on the opportunity for you to get support from the CRN. But also, I really want to emphasise the fact that we are still learning when it comes to social care. And what we really want to do is work with social care practitioners, social care researchers, and the sort of wider community to develop our offering. It's relatively new that we're working in this setting, in this space. So we're very keen to learn what we don't know, and the support that we offer is based on what we've traditionally offered the NHS and primary care and community dentistry and community pharmacy. But we are aware that there's probably lots of things that people working within social care, social services, social work research might need that we could provide that we just don't know about. So really a lot of what we're all trying to do is open a dialogue and find out what it is that we can do and how we can develop our offering. So engaging with us and working with us as early as possible in your ideas about a study. And obviously we link in with all the NIHR colleagues that have been speaking and are speaking today in order to provide as well-rounded support for your study as we can. So if you could move on to the next slide, please. Thank you. So like I said, we're still developing our offering, and we would like to know what it is that we don't know. And so, like I said, a lot of our conversations are that it's not, well, here's what we could do. It's, well, what do you need? Let's see how we can support that. And very excitingly, each of the CRN regions has been given some additional funding for at least the next 3 years to support research, specifically in non-traditional NHS settings. And that is allowing us to be much more flexible, to think much bigger, to have bigger teams of people, but actually to really put into place in a very practical way with actual staff and people and time, something that has been sort of a bit of a dream for us, and we've been doing with very small numbers of staff. So it's a really exciting time for us and a great time for me to be talking, or Sandra and I to be talking to you guys. Can I have the next slide, please? Thank you. So just a little bit about the workforce and the structure. So we have a national coordinating centre, and then there are 15 local clinical research networks which are geographically placed around the country. Each of those has network funded research delivery staff in hospital trusts, but also now in universities, in general practices, in local authorities, in all sorts of different health and social care settings, and that is expanding. And really, I think a lot of us are starting to think, well, you know, perhaps the sky's the limit in terms of how far into the community we might be able to spread our delivery workforce. We also have slightly different structure in different regions, but there is also a sort of internal core team of staff that support early contact. So that's what we call pre-fund. That's what we call the phase that's pre-grant funding, and then teams that work with setting up studies in the different settings, and that structure is slightly different depending on where you are around the country. We cover 30 health specialties plus social care. So social care isn't seen as a specialty, it's seen more as a setting. And I think there's pros and cons to both ways of it being, but I think there is quite a lot of pressure for social care to become a little bit more of a specialty. Can I have the next slide, please? So this is where the networks are. Thanks for putting that on. And the way we work is that we would link in with colleagues in other networks to provide a kind of easier access, more streamlined support. So we work nationally. There are networks in the devolved nations. They work slightly differently, but we do work in collaboration with them. So there is coverage for the whole of the UK. If you contact your local clinical research network, what they will do is navigate and support and coordinate across the other regions on your behalf and help you work nationally in whatever way you want. So that's where all the networks are. Your local network, so if you were based at the University of Kent, then we in Kent, Surrey and Sussex would be your local network, and we would take on what's called the lead network. So we would lead on comms and lead on rolling out your study, depending on how far you needed to go. But what's great is that if you access one network, then you have access to the support and the access to the populations of wherever in the country you need or want to run your study. Have the next slide, please. Thank you. So the aims of the Clinical Research Network are mainly about equity of access to research. And that is what we, at the core of what we do, is what we want to do, is to enable citizens and staff from all across the country to be able to take part in and benefit from health and care research. And that comes from integrating it with frontline care so that it becomes part of everyday business to offer the opportunity to take part in research where there is a suitable piece of research available. It's also about helping make sure that things are done as streamlined as possible, that they're done as quickly as possible, that we coordinate as much as possible, and that we are maintaining quality. And also wanting to, where it's appropriate, increase collaboration with industry partners, because that brings money into the system and access to new, if you're thinking in a clinical context, new therapies, but perhaps new devices. Perhaps we've got some studies in care homes that are looking at using telemedicine or in people's actual homes. And so that's where collaboration with industry can really make a big difference. Have the next slide, please. Thank you. So the Clinical Research Network supports studies that are part of a database of studies that are considered to be high quality, of clear relevance to the NHS and social care. And it's usually around who has funded the study and whether that funding has been given in open competition across the UK. There are a list of eligible funders online, and I've got some links at the end of the presentation, but we can also circulate those to you in terms of how you find out who's on that list. But funders are eligible to join. So if they award their funding in open competition, then we can have them added to that list, and then the studies can be eligible for the portfolio. And information on on participant recruitment to studies is uploaded to a central system, and then that's used to inform how the allocation of funding for the infrastructure for research across each local region, and that is used to support investment in those staff and in the time to support studies in the future. So having a study added to the portfolio, having as many studies included in the portfolio as possible, and not just providing support for the researchers in terms of support to deliver the study or find sites for the study, or access to additional funding streams, but also it helps bring money back into the local health and care economy in terms of research funding for that infrastructure. Thank you. Yeah, if you can move on. Thank you. So like I said, we support all kinds of health and social care research, not just clinical, and that's broadening all the time. And really, partly because we are still developing what it is we might be able to do to support, but anyway, just so that we can plan resources, the earlier you can get in touch with us, the better. And like I said, we do link in with very closely with colleagues from the ARC and from the RDS. And where we can, we join local authority research meetings. We join in with, if we're thinking NHS, with NHS meetings. We try and engage with researchers at universities and try and find out what's going on, what ideas people have got, so that we can link all of the support that there is up together and streamline that support, so that we can help with advising on the delivery of studies as early as possible. We also have some remit when it comes to some of the paperwork that's required for a lot of funding applications. And so the earlier we have sight of that and the more input that we can have to that, along with the other colleagues, the better. So really, there's not really such a thing as too early. We can always say, we're going to pass you over to colleagues and come back to us. But really, we like to know so that we can offer you the full support that we have got available. Can I have the next slide, please? So it doesn't matter where research is happening, if it's health-related research, what type of study it is, what size the study is, or what the focus is, as long as it meets the Department of Health and Social Care's definition of research. It has full research funding, and like I said, we can get certain funding streams and partners to be eligible to be included on the portfolio, and having appropriate ethical and governance permissions and approvals in place or planned, and we can actually help advise on that as well. So if you're not sure what you need for your study, then we can help with that, sort of all the things, the practical delivery aspects of getting your study going. Have the next slide, please. So the other things we can offer advice on are eligibility for the portfolio and get studies onto the portfolio. There is paperwork associated with that, but the new money we have is allowing us, certainly in Kent, Surrey and Sussex, to be more flexible with how we support studies. So really taking away a lot of the bureaucracy, trying to do that for you. Yes, we have to ask you the information, but actually dealing with the paperwork on your behalf, because we know that additional forms is not something that anyone wants to fill in. There's enough to do. We can help review the design and deliverability of your study. We can help explore recruitment pathways. And we're doing that. We're offering that to NHS colleagues as well as to non-NHS colleagues, and saying, well, actually, is there a pathway for recruitment through a different setting, even though it might be a study that's based in a hospital? We can help attribute the costs so that your study is correctly and fully funded. And I think that's a really key thing that we're able to do. And there's a form called a Schedule of Events Costing Attribution Tool. It's abbreviated to SOCAT or SOECAT. People don't, seem to, if they know about it, seem to dread it. But we can help with that. We can help fill it in. We will validate it. We can help advise on regulatory submissions and give you all sorts of intelligence, not just from your local, so your lead network, but anywhere else around the country you might want to run the study, in order to help make sure that it's going to be designed in a way that it would be as successful as possible. And we can help with involvement from patients and the public in terms of the delivery of studies as well, and that complements support that's given from other NIHR partner organisations. Have the next slide. So we can help support research settings by training, mentoring, providing resources to staff that are working in social care or other NHS settings. We can also help support you guys with training and resources, so people who have actually got research ideas. There are some funding streams that studies that are on the portfolio are eligible to apply to have costs recouped from, so we can help with that, and we can help connect up. We're a network, and that's what we want to do, is help network, and that's why events like this are brilliant, because it brings people together, and we can help do that as well. So maybe help buddying up, help with mentoring, help with design and delivery of studies. Could we move on to the next slide? Thank you. And support for setting up a study. So helping to find sites that would be interested in taking part. That can be linking with sites you or we already know about, finding new sites. We spend a lot of time going out and trying to engage new sites and to get them infused about research and wanting to help take part. We can help advise on permission, so getting sites set up. We can be a central point of contact for you within a region, so that you don't have to deal with 50, 60, 70, maybe care homes, that we can help work and liaise that with you if that would be useful and something that you would like. Alternatively, we don't have to do that, we can leave it for you. We can help with training sites and supporting them to deliver the study. We've talked about the funding that is available. It's called support costs, service support costs. You may be familiar with that terminology. We have teams that can help deliver your study, so staff that can go into sites and different settings and actually undertake the recruitment for you. Obviously, there's capacity issues within regions. That hopefully is going to be much less now we've got this money. It's very recent, so a lot of us are just really getting the staff in place, but it's very exciting to think about how in the next few months our ability to actually physically do the help with the recruitment where that's appropriate and where the sites need it. It's really exciting to think how much that will expand, and we can help make sure that the study is performance managed, that the recruitment happens within the time frame that you want it to happen and to the target that you need for your study. Have the next slide, please. So I just wanted to move on to some examples of studies that we have available, or that we have, supported, or some of these are being recruited now, some of them are finished, just as an idea of the spread of studies. And this is really just a starter. We know that there's a lot more going on around and about, and there's a lot more that we could support. So we really are excited at what the future might bring. So the first is looking at the impact of community engagement on care home residents' quality of life. We've got a study looking at bathing adaptations in the homes of older adults. A study promoting good practice in relation to alcohol use in care homes for older people. Improving social care support for victims of violence in the British South Asian community, and improving the oral health of older adults in care homes. And that's just a start. We have some examples of some COVID related studies as well that are running, particularly in care homes. I think it's fair to say that's where the bulk of the social care COVID related research is. So a study that was looking initially at transmission, and now that's also incorporating the vaccine surveillance programme, so that's called Vivaldi. And another study which is just starting, which is called Protect Care Homes, which is looking at post-exposure prophylaxis and against COVID-19, and that is just getting off the ground now, which is very exciting to think about how that might be able to help complement the vaccination programme. Sandra, I realise I've talked a lot and I've gone through all those examples. I don't know if there's anything you wanted to add or anything you wanted to say about any of the example studies we've got.
I think just to say, I mean, the topic study, I think is sometimes it's about thinking about patient benefit, and, oral health in care homes has been a kind of quite topical in recent years, and NICE have implemented some guidelines around that. And the beauty of this study is that every care home resident will get an oral health hygiene check, which they might not otherwise get. So it's thinking about patient benefit sometimes, isn't it? Or care home, you know, any care home residents benefit as well.
Yeah, absolutely. Thanks, Sandra. Right, next slide, please. I think this is my last one. Yeah.
I think we need to keep a bit of an eye on the time, Becky. Sorry to push.
No,
Thanks.
that's okay. This is the last slide. So I guess it's just really summing up that we are focusing on developing our offering to social care, adults and children, getting to know people, expanding into the wider social care setting, particularly trying to target those parts of our communities that perhaps don't traditionally or haven't traditionally had access to research, and looking at where we can sort of use technology to help us with this as well. So on that note, I will finish up there. I think the next slide is just some contact details. So happy for people to get in touch with us if you've got anything that you'd like to ask or studies that you'd like to be supported. Thank you.
Thank you very much, Becky, and thanks, Sandra, for your contribution. This is very useful to hear about all the different agencies or organizations involved. And I just want to finish briefly before we move on to the breakout sessions to kind of reassure people. So there was a lot of information provided, and I think various speakers have alluded to the incessant use of acronyms, which we nowadays try to reduce a little bit, but it's quite difficult. It's an ingrained culture, deeply ingrained in the NHS and I think social care, local authority worlds as well. But I want to emphasize these various bodies like the CRN, the ARC. There is also some organizations which haven't been mentioned, but there is a mention in the question and answer, the clinical trials units. So we all talk about clinical trials units, clinical research networks, but we all moved now beyond that into social care and public health as well. Sometimes more, sometimes less. So it's important to just be aware of these different bodies and look for help when you need it. And there is the CRN, there is also the, above all, and this is why we have this event, the Research Design Service, where we can have a very initial discussion, really starting from an idea stage to developing a research question or some objectives for a project, and then evolving that. And all of us are happy to, you know, guide you to these other organizations where you can have specific help on a range of issues. So don't let this amount of information put you off. I think it reflects the complexity of doing research now, which is almost entirely, I would say actually entirely done in teams. The old idea of a lone researcher really doesn't work any longer. And I believe what Matthew said earlier on about having some colleagues or who are interested in your work or think this is really a good idea, this kind of network building or team building is very essential to getting off the ground at some point and having a complete proposal, submitting it, and even better if it gets funded. So I don't want to now take up more time on this, but just wanted to sort of say this. I also want to thank all the speakers. I want to also thank the attendees. Unfortunately, we can't see them in this sort of system, and invite you now to join the 3 breakout sessions where you should have links available. This is in a separate Teams meeting now rather than the one which we are in now. So thank you very much to all speakers. Thanks to the audience, and looking forward to seeing some of you in the breakout rooms.